All right, one more time again. If you guys could see my title screen, type yes, please. All right, sick. So thank you for joining. So with this presentation, I just want to start off by saying, as a medical student, we are always struggling to improve our CVs or resumes to make ourselves competitive to hopefully get that best possible residency position that we could obtain. If you are a medical student struggling to gear up your CV, this is a simple way to maximize point for application. Today, I will be talking to you about what are case reports and how to write them. My name is Austin Corpus. I am a third-year student. I have written and published articles since high school, starting with local magazine companies in my hometown. These were like non-academia pieces, but as a medical student, I published and I am publishing multiple case reports and articles on medical journals. And I am also writing and publishing an article on sites like USMLE RX Bricks. That's that step practice question service that first aid book used, our medical student Bible that helped us get through step one. Today, I also have a special guest speaker. His name is Hussein Aden. He'll be interacting in the chat and will be speaking towards the end of the presentation. Feel free to ask questions during the presentation. For the sake of time, I'm probably gonna address those questions at the end of the presentation. So what are case reports? Case reports are a summary of a rare or unusual clinical condition and or use of treatments or intervention. Let me repeat this again for the people in the back. Case reports are a summary of a rare or unusual clinical condition and or unique use of treatments or intervention. They are a great way to improve awareness among physicians across the globe, and they look great on applications. For us medical students, cases are really easy to write in a few hours' time over a weekend. They can also easily be turned into a poster or oral presentation. So research is very important, and it can include presenting case reports at conference or fairs, or publishing articles in journals. Research is something that program and program directors look at in residency. Most programs look for at least 2 to sometimes 50 publications, depending on which specialty you're interested in. The thing we could do as medical students is to position ourselves for a successful match is very important. That's what we're trying to accomplish today with learning what are case reports and how to write them. We are seeing very interesting cases, especially here in Warner Robins and the surrounding area. We have patients that have like 1 in a million diseases that are seen during our rotations. And we're seeing these patients, and we can present these cases in regional or national conferences and put them in publications such as medical journals. In short, like I said, we could actually present these cases and not only build our resumes and CVs, but also bring national awareness to Trinity and to showcase the level of academic work that we're doing here in Warner Robins. So I highly encourage you to learn how to recognize these opportunities and act upon them. So here's a picture of couple conference I attended. You can do oral presentations. These are like stock photos of poster presentations about research. Maybe some of them are case reports. So it's important to use cases that have not been extensively researched or published before. Before you start writing your case reports, it's a good idea to get a brief literature review. This includes researching and reading peer-reviewed articles on databases like PubMed or Google Scholar. This helps you familiarize yourself and the subject area. You want to identify what's already out there and find out if there's any gaps in knowledge so you could focus your case report on these areas. My first step to writing case report is to identify a suitable case. It may be that you already identified a case that you could use. Perhaps you're lucky enough to observe a patient during rotations and you want to write up their clinical history and treatment plan. However, if you haven't, it's worthwhile speaking to your preceptors or doctors you are rotating with if they have any interesting cases. Some preceptors have tons of cases, but they themselves don't have time to write them out. It doesn't hurt to ask. So additionally, you can consult your SGA research committee. It's currently comprised of the research chair, Nicole Pellin, and me. We also have volunteer help with students assisting like Omar Hossein. We also have Faluq, he's our core rotation chair. He could get you in contact with certain preceptors about if they have any cases that they have wanting to write out and stuff, or need assistance to write out. So the core component of a case report are title, abstract, introduction, case presentation, discussion, and conclusion. We'll briefly go over what each section entails. Personally, when I write my case report, I find it easier to start with case presentation, then move on to the introduction, the discussion, and lastly, the title, conclusion, and abstract. So I will be talking through this presentation in this format. Today, I'm going to be using my case report that I recently got published. Disclaimer, I am not sponsored by this journal. I'm not getting any financial reward for promoting them. And as far as I know, I don't think the school's have any partnership with them. So starting off with case presentation. So with the case presentation section, it contains the initial presentation, which is the patient's history, followed by the differential diagnosis, investigation, treatment, and outcomes. Things to include are the current medical condition and primary complaint with detailed history, including relevant family history, occupational and social history, medication, and allergy. Finding of physical examination should be briefly reported to with all relevant investigations, laboratory results, and images, and its analysis. You want to describe the differential diagnosis and the rationale of management approach, and including any follow-up results and final diagnosis. The section should be supplemented with any necessary images and tables to facilitate the reader's understanding of the case. So when I read my example regarding my case report, just focus on the structure and the included material, less about the information about the actual case. So for my case presentation, a 32-year-old male presented to the ED for an acute onset of painful swelling localized to the posterior side of the right scrotum. The patient was sexually active, a former smoker, reported being hit in the testicles or scrotum with a cardboard box a few weeks ago. The patient described intermittent history of unilateral swelling and painful sensation emanating from the right posterior scrotum. He was admitted to recent changes in urinary frequency, but had normal urine flow upon voiding, but denied any history of hematuria. Furthermore, the patient denied any recent onset of fever, weight loss, or general fatigue. The initial impression of acute epididymitis was made. Upon performing a physical examination, a unilateral warm erythematous firm right testicular mass was discovered in a normal orientation. An ultrasound was performed, which revealed a mass with a small hydrocele. It also showed a presence of arterial blood flow on the right testicular scrotum without evidence of testicular displacement. So a diagnosis of a testicular neoplasm was highly suspected and surgery was pursued. Prior to surgery, initial blood workup revealed elevation AFP. A right oreectomy was performed, which showed the stage classification of P1B, CN1, M1A, and S1. Given the pathological report, a follow CT workup was conducted, which revealed metastasis to the abdominal wall. The patient had a PET scan and a blood workup was rechecked, which showed elevation AFP. The patient was referred and seen by a medical oncology team for further management. The patient was started on first-line chemotherapy with bleomycin, etoposide, and cisplatin, and scheduled for a PET scan upon completion of treatment. So other quick tip, when it comes to writing this particular part of the case report, it is important to describe events in chronological order as they happen. Also, when it comes to writing the history, make sure you include any relevant negatives. For the investigation section, it may be useful to create a table or graph. Make sure you remove any identifiable details such as patient's name, date of birth, or date of admission. Always write this section in past tense. So the next part, we're going to talk about the introduction. So the introduction summarizes background information about this topic. This is where your literature review that you already done will come in handy. So summarize the relevant facts about the clinical condition and highlight what has already been known on the topic area and any gaps of knowledge. So the things you want to include are the definition and brief description of the pathology, including common presentations and disease progressions, explain the background of the selected topic, followed by a brief description of what is also being reported and the importance of reporting such case. The contents should be clear, focused, concise, and attract the reader's attention and interest. So back to my example, testicular tumors are relatively rare, accounting to 1 to 2% of cancer among young men in the United States. However, the mortality rate has declined across the board owing to the advancements of chemotherapy. Testicular tumor is most common solid malignant tumor in young men aged 15 to 35 years of age in the US. The testicular tumor is classified into two groups according to their pathology, germ cell tumors and non-germ cell tumor. And they are further categorized into two categories, seminatomous and non-seminatomous tumors. Mixed germ cell tumors is a type of testicular tumor with two or more GCT types with a single mass and accounts for 1/3 of all testicular germ cell tumors. The etiology of testicular tumors are multifactorial, and the U.S. Preventative Service Task Force recommends against routine screening for testicular cancer in asymptomatic adolescents and adults due to its low prevalence. Testicular cancer is curable even when metastasized. The overall 5-year survival rate is 97% with effective treatment. So since we have the introduction out of the way, it's time to discuss about the discussion part. So the section explains your rationale and approach with added additional relevant information about the uniqueness of the case. For the discussion, focus on any learning points and unique aspect about your case and compare and contrast your case with other studies and case reports that are already